Now your temporal mandibular joint, also known as a TMJ, so this is the joint of your jaw, and it's a modified hinge joint. Now this joint, it lies just anterior to the ear. Now at this point, the mandibular condyle, it articulates with the inferior surface of the squamous temporal bone. The mandibular condyle is X-shaped, whereas the articular surface of the temporal bone, it has a more of a complex shape. Posteriorly, it forms this concave mandibular fossa, and anteriorly, it forms a dense knob-like structure that's called this articular tubercle. Now, the lateral aspects of the loose articular capsule that enclose the joint, it thickens into this lateral ligament. Now, the two type of movements you get at your TMJ are as follows. The very first one is going to be a hinge movement, and this is going to depress and elevate your mandible. The second movement that we get is this gliding movement. So you get this side to side, what we call this lateral excursion, and this you can see when you're grinding your teeth. Now, with that said, your mandible, your temporomandibular joint, your TMJ, this is the most easily dislocated joint in the body. However, if you go to the doctor, they can align it back in place quite simply. And the way that they do that is that they place their thumbs in the patient's mouth, and then between your molars and your cheeks, and then they just push the mandible inferior and posteriorly, and that'll end up realigning it back into position. So in this illustration, again, you can see your skull over here. This is the zygomatic process over here, and you see this lateral ligament over here, and you can also see the articular capsule. So again, yeah, this is your jawbone over here, the temporomandibular joint. Now over here, you can see again. So remember, synovial joint. So you have your synovial membranes over here, right over there. This is the synovial cavity over there. It spans throughout this joint, and this is going to be the condylar process of your mandible that articulates with the mandibular fossa. So again, this is another illustration, and what they're trying to show you is this. You have this. So again, you're looking at a superior view of your mandible, and they're showing you this lateral excursion. So this side-to-side movement that you get of your mandible. Now, so as I mentioned earlier, dislocation of the TMJ is most common because of the shallow socket that this joint has, and again, almost always this joint it dislocates anteriorly, and when this happens, the patient's mouth that'll stay open. They're not going to be able to close their mouth. So again, like I said earlier, in order to realign it, it's quite simple. The doctor goes in, he takes his thumbs, puts it in your mouth between your molars, and then he's going to push. He's going to end up pushing inferiorly and then posteriorly until it gets realigned back into position. It'll just snap back in position. Now, around 5% of Americans they suffer from painful temporomandibular disorders. The most common symptoms of the temporomandibular disorders they include pain in the ear and face, tenderness of the jaw muscles, popping sounds when the mouth opens, and joint stiffness. Now, this is usually caused by painful spasms of the chewing muscles. Now, TMJ disorders, they often afflict people who grind their teeth. However, this could also result from jaw trauma or from poor occlusion of your teeth. Now, treatment, it usually focuses on possibly giving the patient a bite plate to reduce grinding of the teeth, and also relaxing jaw muscles also helps. So, they may give some muscle relaxers to help achieve this, or, you can also try, they might have you apply some heat or ice to it. And also, all these things, they kind of help. And in addition to that, you can try, they may have you try some stress reduction techniques also.